So how many joints do you think are in an elbow? Here's the possible answers: 1, 3, or 4. And any one of those is in some sense defensible. Pick your answer. And the answer that I would go for is 4. The reason you might say 1 is because you could say, okay, it's a hinge joint and it's one joint. What are you on about? Okay, fair enough. Oversimplification, and we'll go through why. But I can understand why you would say that. Then you could say 3 joints because you could say inside the elbow joint capsule there are actually 3 joints, which is correct. That's anatomically true. But functionally, I would argue that the answer is 4. So in this video, we're going to go through the functional elbow anatomy and biomechanics, a little bit of biomechanics, by understanding the 4 joints that contribute to elbow functionality, which is a hinge joint here, a ball and socket joint here, and pivot joints here and here. And those 4 joints are what make up the elbow. And in the end, we're going to understand how they work together. And here you can see a picture of 2 gentlemen and perhaps a third one in the background as well, clearly laying some foundations for a building. And much like a building needs foundations, so does the elbow. And the foundation of the elbow is really the humeroulnar joint. So you've got a skeleton here, a human skeleton, 2 of them, one from the front, one from the back. And we'll look at, here you have the humerus of the upper limb, here you have the ulnar, and next to it the radius. So the articulation, so the joint, the articulation between the ulnar and the humerus is what forms the foundation of the elbow. On this side you can see it here, the humerus and the ulnar, and here's the radius. Okay, so but we're first going to focus on the humeroulnar joint. In this slide you can see a bunch of pictures of humeruses, radii and ulnar, and the articulation in between them. Let's start with the humerus. So this is your left humerus, and we can see that because the capitulum is on the lateral side, so this has to be left. And this is the same left humerus from the posterior side, and this is anterior. This part here is called the trochlea of the humerus, and it's the same here, and that's where the hinge joint, that's the humeral side of the hinge joint of the elbow. And then in here you have, and then basically you get the ulnar here. This is the left ulnar with the trochlea notch here, and the trochlea notch slots into the trochlea here, and part of the ulnar is something called the olecranon here, which is the back of the elbow. And that back of the elbow can fold into this little fossa here called the olecranon fossa. Okay, and here you can see the this is actually the right elbow now. These are left humeri, so this is a little bit confusing. But here you have the trochlea of humerus and the trochlea notch of ulnar, and that slots right in there, and there's a joint capsule around it. And that forms the hinge joint component of the elbow, and that allows for flexion and extension of the elbow. So that's a really, really crucial component. So this slide shows a bunch of cars with the Mobility logo, which is a Swiss car sharing company. And much like the Swiss have determined that they need mobility, so does the elbow. Whereas the Swiss get their mobility from this cooperative car sharing company, the elbow gets its mobility from the radiohumeral joint. So let's look at, once again, we've got the humerus here from behind, and here it's from the front. And here we've got the radius. And here we've got the radius from the front. So the articulation between the humerus and the radius is the radiohumeral joint. And it's a ball and socket joint, unlike a hinge joint. So a ball and socket joint is not inherently constrained in its in the planes in which it can move. So whereas the hinge joint can literally only move in one plane, so it can only do flexion and extension, the ball and socket joint could kind of do almost any movement. So it could, but there's a bit of constraint applied to it, and we're going to find out what that constraint is in the future. So, well, in this video, later on in this video. So here's a radius, okay, left radius, and it has the radial head. So this is the proximal end of the radius, and this is the distal end of the radius. So it has a neck and a head, and the head is, here you can actually see the head from the top. So you can see that it's concave, okay? So concave means it's like that, okay? And the humerus has a part called capitulum, which is convex, so it's curved outwards, whereas the radial head is curved inwards. So it's sort of a reverse, it's sort of the reverse configuration of the shoulder joint, if you will, where the proximal end of the joint is convex and the distal end is concave. So this slots into here, and that means that it can rotate around and move around in flexion and extension. And that's really important because that joint allows for pronation and supination of the forearm. So it allows you to do this. Here you have 3 gentlemen in a boat, and much like these 3 gentlemen in a boat, there are 3 proper joints within the joint capsule of the elbow. Let's talk about the 3rd joint, which is the proximal radioulnar joint, which is the joint just here between the radius and ulnar on the proximal end, and you can see it here as well. That's something called a pivot joint. Okay, a pivot joint is where you have a surface like this with a round surface, and the round surface can turn within the convex round surface turns within the concave surface, and that's what you have here. So if you look at the head of radius, it has 2 articular surfaces. Yes, it has this articular surface for the radiohumeral joint, but it also has this articular surface, which is also called the articular circumference of radius, which articulates with the ulnar at the proximal radioulnar joint. And the ulnar has something here called the radial notch of ulnar, where the radius slots into that, and that hinge joint limits the movements of the radius, and it constrains the movements of the radius to always be with the ulnar. And that hinge joint allows for only rotation. So it only allows for this radius to rotate here. We should probably mention at this point that if you look at this diagram with the joint capsule of the elbow opened, we can actually see all 3 joints that we've talked about so far. So you've got the humeroulnar joint here, you've got the humeroradial joint there, and the proximal radioulnar joint there, and they all sit within the same joint capsule. Here we have a picture of a puzzle with some missing pieces, and much like this puzzle is missing pieces, the puzzle of the elbow joint is still missing 1 piece, which is the distal radioulnar joint here. Okay, and somewhere there, it's a little bit buried, you can't, oh, actually it's right there if you look at it, here and here. Okay, so the distal articulation between the radius and the ulnar. So the radius articulates with the ulnar not just proximally here, but also distally here. So basically, if we look at the radius, where's a good diagram of the radius actually? Oh, by the way, this is a fantastic picture of the radial notch of ulnar. That would have been useful to mention previously, but you know, there we go. Basically, oh, here we have it. Okay, so this small picture shows the radius next to the ulnar connected at the proximal radioulnar joint and at the distal radioulnar joint. And the distal radioulnar joint is also a pivot joint, but the configuration of the pivot is reversed. So at the proximal end, the radius provides the convex surface, but at the distal end, it provides the concave surface. Let's see if we've got a better diagram of that, because basically where you know how the ulnar here has the radial notch of ulnar, the radius also has something called the ulnar notch of radius, so the notch into which a thinner distal end of ulnar sits. And basically what that does is this part of the radius goes around the ulnar. So your ulnar stays stable and the radius goes around it. And you can visualize how that works if you look at my index finger, and you can see how it curves around, and the index finger very much follows the radius in this sense. So that's called circumduction. So the radius circumducts the ulnar. And the important thing about this is that when you take these four joints together, you've got the hinge joint, the humeroulnar hinge joint, which allows for flexion and extension. And then you've got the ball and socket joint here, which means that the radius can follow the ulnar in flexion and extension. The proximal radioulnar joint allows, in line, as well as the ball and socket joint, allow for pronation and supination. And the distal radioulnar joint basically tethers the distal end of radius to the distal end of ulnar, meaning that the pronation and supination of your forearm can occur in any position of flexion or extension, and the radius will always follow the ulnar. And that is how these four joints work together to produce the functioning elbow joint. And let's just recap that. So you've got the hinge joint here of the humeroulnar joint. Then you've got the ball and socket joint here, the radiohumeral joint. Then you've got the paired pivot joints here and here, the proximal and distal radioulnar joints. And let's just, to really make this lesson sink in, let's think about what would happen if these joints weren't there. So without the distal radioulnar joint, you couldn't have smooth pronation and supination, because the radius would not be tethered to the ulnar distally. Without the proximal radioulnar joint, pronation and supination would likewise not be possible, because there would be just like a bunch of friction here. Without the ball and socket joint of the radiohumeral joint, you couldn't have the combination of flexion and extension, pronation and supination, and pronation and supination in any position of flexion and extension, because that's what the ball and socket joints allows for, but its movements are limited by the pair of the radioulnar joints. And finally, if you wouldn't have the humeroulnar joint, so this joint right here, then you wouldn't really have an elbow to begin with. So that is how the pivot joints here and here, the hinge joint here, and the ball and socket joint here make up a functioning elbow. If you found this video useful, then please subscribe to my YouTube channel to receive more videos like this into your feed. And if you think that someone else might benefit from this video, then please share it with them. So my name's Arrow, I'm a doctor from the UK, and I am planning to make a lot more of these videos, planning to make about one video a week, just basically anatomy videos from first principles to help you understand not just what the structures are, but why they're there and why they have to be there. Because anatomy, in the end, is so deeply logical, but I don't know that it's always taught from that perspective, because it's too easy to just memorize it. Anyway, that's probably a discussion for a different time. But nonetheless, please subscribe. Bye-bye.